A very good evening to you, our family, our Oracle TV viewers, our online family. We love and appreciate you so much. Thank you for being here. Thank you for always supporting us. Thank you for always showing up. Thank you for always sharing the lives. We do not take that for granted. And today is another great episode for you to learn something new. And you know when you are on air is that part. Lazima nifanye kuwa kauchafu fulani kachoke, and then to relearn some things, of course, and learn some things and make sure that you know the facts about what is happening. Kuna zile vitu zetu tumekuwa tukizibeba along, carrying them along, and it's a myth. It is not the truth. And that is why I bring in specialists so that they can emphasize on the truth and the facts of the matter. And when you see the health desk, you know that it's that time to learn something about your health, because you know your health is very important. Your health is the first wealth that you will have. You can have so much money, but if you don't have good health, where will you use the money for? So make sure pesa yako si ati iko pale. So take care of your health first, then the wealth follows. And of course it's me, Trevilla Luta, tuandamane mpaka tamati mpaka pale mwisho. Usijaribu kushika hiyo button, kuwa glued hapo na upate nini. This is the time that allow you to put the full blast. Ndio paka jirani asaidike. Ndio paka huyo jirani yule mwingine asaidike. Wasiseme ati wakusikia. Make sure umewasaidia, and that is the best way to help them. And of course I have somebody on board. This guest that I'm bringing on board, kuna wale watu wamesema, unajua meno yangu, unajua my teeth, you know my teeth, and I heard your cry. Your teeth, now I heard your cry, and I've decided to bring in a specialist in that area, a dentist, so that she will explain to us all things concerning teeth and what are the myths, what are the facts, how are you supposed to be doing this, have you been doing it wrong? And Jumimi si daktari yos area, I want her to introduce herself. I want her to tell you where you can find her, and I want her to tell you ni nini unafaa kushikilia kabisa. Ndio ukienda mahali pia unajijaza, you go like a person who know what you're talking about. Karibu sana daktari, Oracle TV, and we thank you for even honoring the invite. Kindly introduce yourself.
Hello everyone, my name is Dr. Sarah Ndaiga, and I'm a dental surgeon. I've been practicing for about 10 years now, a decade.
Wow.
And I am passionate about family dentistry, general families, dentistry from children all the way to the old ones. So asante sana for inviting me to Oracle TV.
Karibu, maybe to a quick question before we start. What actually inspired you to become a dentist?
Well, I wanted to become a general dentist, a general doctor when I began my university, and that's what I had applied for. But I think life had other plans. So, you know, the way they invite you to university, in our years, you had to apply, and then they call you for, they shortlist you. So I was shortlisted for dentistry, and I had actually gone thinking I am going to maybe change the course or something. But then I discovered what dentistry is about. It's not just teeth and removing teeth. It's a whole health sector on its own, about oral health. It's about caring for patients. It's about changing smiles. It's about actually changing lives of people through how they smile and how confident they are. So I fell in love with dentistry, and I am passionate about it now.
Wow, that is amazing.
Yes.
So if you're there, please sit down. This is the time that you don't move. Kama kuna chakula ilikuwa inaiva, wetu I allow you. Ambia tu watu wakubalie for this time upunguze moto ilikuwa inaiva kwa mbali, so that you can get everything. Maybe the time that you'll get to go and look for the food, or to get out to go do your 1, 2, 3, you'll miss the important point that you're supposed to be listening to. And maybe that is what you've been asking for, and the answer is here. But before we continue, I want to invite you to partner with Oracle TV. It's a very simple thing. Yani kitu tu rahisi kabisa. To partner with us is very simple. You go to your pay bill number, that is 171133. Account is Oracle TV. When you do that, you allow us to be on air every single time. You allow us to make people, their lives to be transformed the way we are transforming one's life right now. Unajua si kila mahali utaenda tupate daktari, but this is the time that we tell you it is the direct line to your medical doctor. So I make sure that every doctor is here. So for me to be here and for you to listen to that part, to that good message, is for you to support Oracle TV so that we'll be on air 24/7. And actually, I acknowledge everyone who has always been supporting Oracle TV, and we love you so much. Feel appreciated and know that you are not just doing it kwa sababu tu watu wanafanya. Just know ni hakiba unajaza. It is your treasures zenye unajaza, and in due time, trust you me. Si tulisema si watoto wako tu ndo wanapata, hadi wewe unapata hiyo kenye umepanda pia you specialist who will answer your question, share vital insight and guide you through your healthier living. Catch me live, Trevilla Luta.
So oral hygiene, of course, the brushing is the first thing that you do at home. So brushing in the morning, after breakfast, and in the evening before you go to bed, that's the basic. But oral hygiene involves much more. It involves more than brushing, flossing. More than flossing, then you have to do your general checkup. We recommend at least once a year, or 6 months, twice a year, you do a general checkup. Yes, so your oral health is more than just the normal brushing. You have to do checkups, you have to do the flossing, and also you have to take care of your diet. Yeah.
Even diet and teeth come together.
Yes, diet and teeth go together very much because the sugar that you eat, if you're constantly maybe snacking on sugary things or on sugary drinks, then what happens? There are bacteria in your mouth, and this bacteria in your mouth.
From the latest medical breakthrough to everyday wellness tips, join me live as I bring you medical specialists who will answer your question, share vital insight, and guide you through your healthier living. Catch me live, Trevilla Luta, every Wednesday from 7 p.m. to 8 p.m. only at the Oracle Television Network. The Health Desk, your direct line to your medical experts. Your health is your wealth. Every week, the Health Desk brings you closer to the experts who care for it and protect it most. From the latest medical breakthrough to everyday wellness tips, join me live as I bring you medical specialists who will answer your question, share vital insight, and guide you through your healthier living. Catch me live, Trevilla Luta, every Wednesday from 7 p.m. to 8 p.m. only at the Oracle Television Network. The Health Desk, your direct line to your medical experts. Your health is your wealth. Every week, the Health Desk brings you closer to the experts who care for it and protect it most. From the latest medical breakthrough to everyday wellness tips, join me live as I bring you medical specialists who will answer your question, share vital insight, and guide you through your healthier living. Catch me live, Trevilla Luta, every Wednesday from
have issues, people who have had braces, or people who actually have gum disease. There is actually a kit that I can give you that normally has some brushes, and then it has a timer. But generally, 3 minutes is good.
3 minutes.
Yes, I know we brushed 30 seconds. No, 3 minutes is good, so that you share around 20 seconds for every side. So there is this, you're supposed to put your brush at an angle, so that you're brushing back and forth. Okay, and not, because also if you brush too hard, then you wear out your gum.
Okay.
So you're not supposed to brush too hard. I see people, 1 minute, people like doing a lot of hard brushing. That's not good for you. So you do circular brushing all around your teeth. So you give at least 20 seconds on the inner side, and then people forget this lower side as well. So you do the brushing around there. And then now on the occlusal surfaces is when you can do the back and forth. the back and forth, because you can put a bit of pressure here, and also on these surfaces are not smooth, so because of that, then you need to put maybe a bit of pressure on the occlusal surfaces. But around the gum, then you do an angle, and then you do circular motions. Yes, or back and forth. If you're using an electric brush, then you don't have to move so much, but you can just do light brushing. So hard brushing will also affect your teeth. So generally, that's how you're supposed to brush. And if you look at how the teeth are, there's this space in between.
Yes.
So if you don't floss, then it means you've missed a very big part of it. So you must floss. It's not every day. You can say maybe twice a week or so you can floss. And then there's the tongue. I don't have the tongue, but there's the tongue.
Okay.
So the tongue, for people who have like bad breath, 80% of the time, it's the plaque on your tongue.
Okay.
So you need what is called tongue cleanser, or for removing all that plaque from your tongue. If you're not able to brush, you can still use the brush on your tongue, but some people might feel a bit uncomfortable. So you can use this tongue scraper, too. Then you know your mouth is good.
Oh, where?
Yes.
Watu wa Mungu, how have you been brushing your teeth? And maybe we have electric brushes and these normal ones.
Yes.
Which one will you advise is the best?
For people who are just have normal cognition and their motor movement is okay, then the normal brush is okay, so long as you know how to use it. But for people who have maybe motor issues, they're not able to hold a brush, even for children who have not developed the motor completely, then I advise them to use the electric brush. But the electric brush or this other brush is not the problem. The problem is the technique of how you brush.
And how long should you change? How far or how fast?
So the brush, if you're buying a nice brush, be checking them. They're usually written whether they are medium, Bristol, or soft. Most people generally will require medium, unless you have maybe braces. Also, we recommend you use like a soft brush. So at least 3 months, then you should change the brush.
3 months.
Yes.
And what are the mistakes, the dental mistakes that people make?
At home, or mostly at home, yeah?
Yes.
So the dental mistakes that I see people making most of the time, the first one I'm going to say is to wait until there is pain. You know, like, daktari, niko na meno hapa lakini hajauma bado, nitakuja ikiuma. That is the biggest mistake I see people making, because dental problems, most of them are silent. They are silent. When that bacteria is eating your sugar and producing acid, hakuna any pain. Hakuna any sensitivity. So if you sit and wait for pain, then the problem becomes much bigger and more expensive even. So your dental checkup is important. So you must go for dental checkup at least once a year or twice a year.
Okay. And why do people experience tooth sensitivity, and how can it be treated?
So tooth sensitivity can be due to various issues. For example, if you're brushing too hard and then your gum recedes, sometimes you've seen people, the gum has receded or it has gone a bit lower.
Yeah.
So that exposes a bit of the root. That will cause sensitivity. Then some people will have cavities. Obviously, cavities, if food gets in here or cold water or something, that causes sensitivity. Mostly, the most causes for sensitivity are usually the recession of the gum and the cavities most of the time. And sometimes you have gum disease that has progressed. So if your gum is swollen, then you expose your teeth to tooth sensitivity.
And since you've mentioned the gums, what brings gum problem? Kwa sababu umesema when you're brushing, the teeth you might never reduce.
Yes.
So what will cause
the gum, let's go back a bit to how we were talking about the brushing. And if you don't brush properly, what happens? You get some tartar remaining around the teeth.
Yeah.
And remember, we said they are bad bacteria. So the bacteria will come around the tartar. So that causes an irritation around the gum. The gum loves that soft, smooth tooth. So if there is anything rough here, then the gum is inflamed, it's irritated, and then it swells a bit. Sometimes you'll see some people have even red gums, yeah. So that's what causes now the gum disease. So if you don't brush properly and tartar builds, then that causes gum disease.
Okay. And does mouthwash replace floss? Because or can you use both of them at the same time?
You can use both of them at the same time, but mouthwash will never replace brushing. It's like showering with perfume, yeah?
Oh, okay.
Yeah. So the mouthwash is for you for that breath to be fresh, but it can never remove this tartar that is here, yeah? It can never remove the tartar. So the brush is a must.
It's a must.
Yes.
So wale ambao tuko tunatoroka.
Mswaki pia ni sawa. You don't have to get this one. Yeah, if you have the mswaki that I see people in the clinic who've been using mswaki and their teeth are very okay. So if you still can't get the brush, the mswaki still works.
Mamuti.
Yes. Yes, that still works. Because what we need is just that removing of the plaque.
Okay, and because those sensitivities and everything is brought by food and what you're taking in, what foods actually may increase the rate of your teeth damages or give you risk?
Okay, so the most ones, of course, we've talked about the sugary things.
Yeah.
If you're eating sweets every 2 minutes, you're drinking your sodas, but also any sticky food. Things like biscuits, you see the way they stick on your teeth, those ones stay there for a longer time, and the bacteria are working on them, and they are getting the cavities. Yeah.
And I don't know if it's a myth or truth. I've heard people say when you take greens too much, your teeth will start having the whatever. What are they called? The black stuffs in your teeth.
Green.
Yes, you love taking greens too much.
That's a myth. There are some foods though that cause tartar.
Okay.
Yeah. So for greens, I haven't seen any studies about the greens causing tartar, but there are some things that cause tartar for sure. Things like tea. If you're constantly having tea and coffee and not brushing maybe in between, that discolors your teeth. So yeah, that one does. But
Okay.
mkule mboga.
Oh, watu mboga wale walikuwa na excuse taribu meno, poleni. Greens kwa wingi. And maybe are braces safe? The braces, the golds, whatever, are they safe? And who should wear them? Because nowadays it has become like it's a thing. It's a
Okay, so yes, braces are safe, and braces, they're not always cosmetic. So sometimes you have the cosmetic procedure. By cosmetic, I mean it's not affecting your biting, it's not affecting your sleep, it's not affecting your eating, but it's affecting maybe your confidentiality and how you smile, like if your teeth aren't in a nice shade line that it should be. But braces are very safe, and anyone can get braces from children all the way to adults. And even though you're 70-year-old, you can still get braces. So there's no really an age limit. But what I can say is that you have to get them done professionally, because if you don't, there are side effects as well. So you have to get them done professionally, and you maintain them the right way. But yes, braces are safe.
Yes. So what is the difference between veneers and braces?
So braces, they're this metal, most of them are metal, but there are also some that are acrylic that we place on the teeth. So they look like metal, we place them on the teeth so that they help align. Then veneers, they are whitening coating that we put on top of the teeth. For example, the people who get the brown teeth, like Nakuru people, we have a problem with the fluorosis. Yes, so for us to cover that sort of discoloration, we use the veneers. Some are direct and some we have to make them in the lab. But both of these procedures, whether veneers or braces, they are safe procedures.
Both of them?
Yes, they are.
And maybe what is the difference between medical and cosmetic dental
procedures?
Yeah.
Well, what I would consider medical is more of the functional bit. So let's say we are dealing with pain If you have dental pain, then we can do extraction, we can do root canal, we can do filling. Those are medical procedures to ease your pain and also for function. Most of the braces actually are medical procedures. Yeah, you find children who have been mouth breathing because they can't, there's a problem with how their jaws are positioned and they can't breathe through the nose. So obviously, if I do braces for that, then it's medical. And some are the cosmetic ones. I could say maybe things like veneers. You just want to smile properly. Yes.
And maybe for a child, what is the first time they should see a dentist?
Well, ideally we say when the first tooth appears, you should come to the dentist.
First tooth?
Yes. So I'd say at 6 months to a year, your children are supposed to have seen the dentist. So I know people like, for what? But what I know from experience is when you bring your child at 1 year, they know this environment is safe. Yeah, so they come, they say high five to me, we check their teeth, we don't have to be doing anything, we might just do a bit of polishing, but they associate that as a friendly environment, so that their whole life will be like going to the dentist is actually fun and not trauma like the way most of us have grown knowing, like going to the dentist is trauma and it's painful. Yeah, so let's introduce the children to the dentist 1 year.
Wait, at what age did you go to the dentist? Ebu put at the comment section. Please, on the comment section down below, tell us at what age did you go to the dentist? Or even, by the way, until right now they are 40, they've never seen a hata ajui kwa dentist kuna kaanga aje, hata hiyo ofisi yake tu ndani. What to find there. So tuambie, at what age did you go to the dentist and what was your fear, and maybe what myth did you have? Kama wale watu wa greens, watu wa greens amtoroki. You're going to eat greens until you feel yes, Lord. Maybe what causes, because nowadays for most teenagers, we see most of them have cavities. Most of them. What do you think is the cause of that?
Well, the major cause, we can't say is usually one cause per se, but I will say it's a contributing factor, is the diet. So you will find that most teenagers, even parents complaining, if it's like a holiday time like this, they'll be in their bedroom with snacks, or like at 11 p.m. or midnight with snacks. So that frequent snacking, obviously, I've already described what it does to the teeth. So that's one of the factors. And some of them, maybe they're not brushing properly. So the combination of the two is what is causing. But mostly, the diet is the number one.
And maybe because most of them are snacking, is sugar the number one thing that causes the tooth decay?
Yes. If actually you're not taking sugar, you'll not have cavities.
Like you're serious?
Yes.
Oh, so if you...
But sugar is not that sugar. You know, sugar is not... Sugar is not sukari tunaongeza kwa chai.
Please clarify. Kwa sababu
sugar is starch. So if you're eating carbohydrates, ugali, particles zibaki kwa meno, that is sugar. Rice, umekula, particles zimebaki kwa meno, that is sugar. Yes, the body converts all this carbohydrate food into sugar.
Now we know.
Yes.
Well, we were told, don't take sugar. We assume it is the sugar, but soda, because we know sodas, they have sugar.
Yes. So ideally what, for the diet, I'm not saying now people don't eat carbohydrate, but what I'm saying for the diet, you eat, like if it's breakfast, you eat, you finish your breakfast, then you drink water. Of course, water rinses out any excess food that was there. And then you don't snack in between. So that keeping snacking is what mostly damages the teeth.
Okay.
Yeah.
And there's, I don't know if it's a myth, another. We have now charcoal toothpaste. So is charcoal toothpaste actually really, it really whiten your teeth?
No, charcoal toothpaste actually is, it has those rough particles. It's actually what it's doing is damaging your enamel.
Okay.
More than helping it. So what I advise, just use the normal toothpaste that has fluoride. you are good to go.
Oh, the only thing you need is fluoride.
Yes, the toothpaste with fluoride so that it can remineralize your teeth. Any mineral that has come out, the fluoride does remineralize. So that's what you need.
Hey, daktari
If you want like the whitening procedures, you can do them professionally. Like if you want your teeth brighter, but avoid these DIY things that can damage your teeth.
wale madentist wa nyumbani leo ni kama daktari amekuja kutumaliza, but actually is it really important for us to whiten our teeth, or how is it safe?
The procedure if done professionally is safe, but there are usually side effects.
Okay.
So the procedure we use for whitening, there's a material we use for whitening, for removing the impurities that have discolored your teeth.
Okay.
But it has to be done under supervision of the dentist, because that material can actually damage your gums in case it were in contact with your gum. Then you have to make sure that. But what you might experience for some people after whitening, they have a bit of sensitivity, which we can also sort.
Okay.
Yeah, but most people benefit with teeth whitening. Yeah.
But it can.
So you have to know there's a side effect that might come with it.
And when you're talking about side effect, the people who remove their teeth, okay, so you come any myth or it is a truth, can it affect your eyesight?
I've heard people saying about this one, but no, there's no connection between the tooth and the eye. But what I will say, the above here, where you have your upper teeth, upper jaw in the bone, you have the sinuses. Yeah, people know I have sinusitis, things like those. So the sinuses are connected to the teeth. So sometimes when you remove the tooth, you might have a bit of inflammation on the sinus, and the sinus is just next to the eye. So when people remove upper teeth, they would feel a bit of your sinusitis, inflammation, and then they would say, my eye has a problem, but it's not really, there's no really connection. The nerve going to the teeth and the ones going to the eye are completely different.
Oh, so that's a myth.
Yeah.
Completely a myth. And maybe what is that one thing you wish people could understand about the dental care?
Well, I think what I would say is that the mouth is a window to your health. So let's not ignore the mouth, because the mouth is a small area, and so one thing that people need to understand is like, one, you can get so many diagnoses of issues before they become complex through the mouth. We usually know people who are diabetic most of the time through coming to the dentist. We usually know people who have bleeding issues coming to the dentist. Actually, dentists also see people who have HIV coming to the dentist first. Like, we are the first people to actually see symptoms in the mouth that indicate something more is going on in the body. So don't ignore any symptoms. Don't ignore your bleeding gum. Don't ignore that bad breath that you have. It could also be an indication of something deeper happening.
Oh, actually, I was to ask about bad breath.
Yeah.
What usually happens to people who have bad breath?
So most of it, as nilikuwa nimesema, is from the tongue. About 80% of it is from the plaque on the tongue. So, of course, the bacteria are fermenting the food there, and they're producing some sulfur gases. That's mostly what causes the bad breath. But for some people, it's a systemic issue. Sometimes when you have diabetes, there's something called ketoacidosis, that you actually produce the breath from your mouth. It has a smell, but it's not from the mouth. It's from the metabolism that are happening in your body. That's what I'm saying. Sometimes you can even detect someone with diabetes by when they come to the dentist through things like those. So mostly it's that, but you can still get systemic issues. Some people who have reflux might also have bad breath. Okay,
so people should not. There are people who fear coming to the dentist because they fear they have bad breath, or they fear they'll be stigmatized when they come. Ama daktari atamwangalia kwa like wewe na wewe. So for somebody like that, what will be your advice? Kwa sababu yeye anataka usaidizi, but anaogopa because maybe the odor is too much.
Most of the time, by the way, I don't even notice the bad breath. Most of the time I don't. But this is what I'll say. If someone is really passionate, if you're coming to a dentist who really loves the work, what they want is for you to get better, to be better, to be confident. That is why I'm here. So I'm not about why are you like this. I'll give you advice. This is what you can do. This is what I can do.
Yeah.
But don't fear coming to the dentist, because dentists are happy to help. Yes.
So just gather the courage.
Yes. Actually, when we see people walking around with tata, we want to tell them kuja tu. But well.
Yeah. And actually, there's somebody who asked a question. I think it is good to address it. Well, the child she has like a young girl, but meno hizi hazijangoka mbili, and then za huku kuna yenye imecrack hapa hivi, and then huku pia imeanza ni kama kuvunjika. What could be the problem?
So depending on the age, and it's good for me to say to the mothers who are breastfeeding, there's something called breastfeeding caries or breastfeeding cavities. So if you leave your child at 1 year, 2 years, breastfeeding like the whole night without taking out the breast from the mouth, then what happens is your sugar. The breast milk is also sugar.
Sugary, yeah.
So that sugar starts damaging the teeth. So you can have a 2-year-old, a 3-year-old with cavities. 7. Yes. So I was talking about the young ones. But now the 7th one might have begun all the way from there, and then continuously now there's a diet and all that. But what we do, there are solutions for these issues. And primary teeth hazifai kutolewa. Zile baby teeth, tunasemanga baby teeth zitang'oka, hazifai kutoka before their time. Because they usually serve an important thing of maintaining the jawbone and also directing the permanent teeth, how they will come out when they are ready.
Oh, so they come out when they are ready?
They come out when they are ready. They're not supposed to be removed. They come out when they're ready. Sometimes we need to help them come out, but they should be signs that they are ready to come out. Some people might have a bit of fibrous gums and might be a bit difficult to remove, but they come out when they are ready.
And what if now they are not coming out, but the other two, the permanent one, is coming out?
That's what I'm saying. Now there are signs that they are ready to come out because the permanent ones are already coming. So for a 7-year-old, we'll have to do fillings. We'll have to cover those cavities so that at least the baby can continue using the teeth until they are ready to come out.
Oh,
yes.
So it's not something serious. Ni kuja uone daktari. Because maybe you might have a deeper question that you might want to ask kenye. Maybe just unaona kama sijasema venye ulikuwa unataka kuisema. Just go see the doctor, let the doctor explain and actually examine the child to know actually what really is the problem. Maybe there might be something more serious than we are just thinking. So just book an appointment and see the doctor and let the doctor explain to you what is really happening to your child. Ama kama kuna kitu inakuwa ni kama ni ya kushtua, ama what is it really happening? Ifai kushtuka sana, it's just something normal. And of course, keep your questions coming on 0711-176-006. Ile maswali mtauliza mingi, it will make daktari to come back again and answer those questions. But keep them coming. The doctor, I'll make sure, mimi ndo plug wenyu mzuri, I'll make sure that I'll bring the doctor again here so that tumeguza tu juju, tujaenda to the deepest part, because huwezi anza na huko ndani. Ukianza ni unaanza na hapa juu. We unwrap first, then we go deeper. So we wanted to know what is this oral, how do we clean our mouths. Wale ambao 30 seconds ndo maana mnashindanga meno zinawauma. It is 3 minutes. And of course, something else that I've learned, I hope you've learned also, we inherit bacteria. That's one thing I've realized today. I didn't know people inherit bacteria from their parents, from their mom. This is deep, but it is good. That is why I tell you the health test is your number one plug. Every time you are on air, make sure you send and share the link so that everybody will get to learn. Everybody will know what hygiene means, how how critical it is, because we take some things for granted. And as you're doing that, please continue partnering with Oracle TV, continue being that one part, continue being that one person that Mungu akishuka hivi wakati wa baraka. I said we cannot all of us be doctors, we cannot all of us be presenters, but whatever you are doing, you're also becoming a doctor, you can be a presenter, because somebody else will learn because you did something to Oracle TV. So make sure you partner with us. It is simple, ni rahisi. 171133 is the PayBill number, account is Oracle TV. And if you feel, me I want mine to be different, nataka you feel kabisa, you can come in with an advert, and of course that advert will go a long way. Wewe unataka biashara, anything, unauza mboga, unauza cereals, uko na boutique, anything you are selling exclusive of alcohol, or anything that kidogo haina morals mzuri, that one we cannot do. But any business we are doing, we'll do that for you. You want us to mention your business right now. We know Bright Shine Schools is there. If you have watu wamefunga shule, unashindwa nitaenda aje kazi, mtoto wangu atafanya nini, just make sure you come into Bright Shine Schools and you'll know your baby will be taken care of vizuri hadi ile wakati kutoka kazi umkujie, and then uende nyumbani. You are guaranteed that the hygiene of the baby is good. You are guaranteed that where the baby will be playing is clean, because unajua watoto at that tender age they are very sensitive and you don't want to joke with their health. So make sure you come to the Bright Shine Schools and utakuwa sorted vizuri kabisa. And of course daktari, as we are ending, I want you to, kuna ile kitu unasikia hii siwezi toka kwa set kama sijasema hii, watu wajue this is it.
Thank you. So maybe two things. One is about the gum disease. So gum disease, progress is not reversible. Wow. The way you feel your teeth starting to shake a bit, the way you see that gum receding is not reversible. So that one, you have to come to the dentist and you have to start treating it early, otherwise it will progress. The other thing is about dental checkup. So I'm here on behalf of Annex PGH, yes. And so we have a dental clinic there running every day from Monday to Friday. You can come in for a dental checkup anytime on those working days. So please come for dental checkup at least once a year. Let's start there. At least once a year, do your dental checkup. And I will be happy to help with your questions. You can actually just come to the dentist and ask questions. Yeah, you can just come. Na nimekuja leo daktari uniexplainia what will I do here, what will I do here. We are usually very ready to help.
Wow.
Yes.
So if you want to see the doctor, amekuambia, you can find her pale Annex. Make sure you go there. Si lazima ukuwe unaumwa na meno ndo uende. Just go for checkup. At least know the health of your tooth. And maybe the last question as you're going, when you go to get checked or you go to wash your teeth, and why is it sensitive? You cannot take anything. Kuna nyao inaenda 1 week. Unasikia hii meno, I cannot take something.
I've had such complaints, to be honest, and I think what I can say is about the technique that was used to clean the teeth. Ideally, if you're using like the right equipment for cleaning, you should not have sensitivity after. Yeah, and sometimes for people who have like that gum recession, if you have a bit of sensitivity, always after that cleaning, we can always give you like a sensitivity toothpaste for use for that duration of time. That reduces your sensitivity quite a bit.
Oh, wow. So you have your answer now. But thank you so much, doctor, for coming.
Thank you.
We surely will invite you again. So now we dig deeper. We go deeper because we want to know more about our health. That is our first priority. Lakini asante sana for coming. And of course, for you there at home, thank you so much for staying tuned. Thank you so much for even calling your friends and sharing the link so that they get to know how sensitive is their tooth and what they are making the mistake and the myths the people have been carrying all along. And of course, thank you so much for always making us #1 TV station. We do not take that for granted. This has been the Health Desk with me, Trevilla Luta. Until next Tuesday, same time, same place. This is where we say this is the direct line to your medical doctor. God bless you.